Dr. Blake Steger here with Westside-Medical. Today we're going to show you guys how to use a lacrosse ball to work the myofascial regions of your lumbar spine. And the two muscles we're going to focus on, the quadratus lumborum, and that muscle is a thin muscle that runs from the top of the rib cage all the way to the top of the hip bone or the ilium here. The next muscle group we need to talk about are the deep erectors right through here, or the multifidus muscle. And the reason why we want to show you how to use the myofascial treatment for it is if you do some kind of repetitive stress, let's say you're at home, gardening, that repetitive stress through there can cause adhesions to the lumbar spine. Or if you're a weightlifter where you're doing like heavy deadlifts, extension stuff like that, adhesions can also develop in those lumbar muscles, causing some pain. So the first step we want to do is we're going to work the quadratus lumborum. And I like to compress the tissues and then pull the tissues to the range of motion. So I call it compress and traction. And so you're going to work the entire muscle itself. So first, you're going to want to shorten the muscle. So you want to shorten its range of motion. So you're going to kind of bend to the side. You're going to put the tennis ball there. And then you kind of just bend away from it. And you want to work the entire muscle. So shorten it, compress, and bend away. So that's the first technique. The second technique we're going to use is for the deep erectors. These muscles, they actually are stretched when you turn to the same side as the muscle. So we're going to work the right deep erectors or multifidus muscle. So you compress it, and then you're going to rotate into the side like this. And you want to work the whole muscle belly. And it's probably about like an inch off the center of your spine, right through here. And so how we add the compression is we have the patient lay down on the floor. Or you just at your gym, lay down on the floor, put your feet up on something. Putting your feet up on something allows you to kind of control your lumbar spine. So you can use a chair or a bench. So you have the patient lay down, put your feet up on something. So first we'll start off with the quadratus lumborum, that side muscle here. So you're going to lay on it, the lacrosse ball. It's going to compress that tissue, and you're going to bend to the side like this. So find where we have those adhesion or tender points. Put your body weight onto it, so that compresses it, and you're going to rotate, you're going to flex away from it. So once again, that's for the quadratus lumborum. Now for the deep erectors, you're going to go about an inch to half an inch off the middle of your spine. That's where the deep erector muscle bellies are. So you can get all your weight on it. See how my hips are off the, you want to zoom in here a little bit? See how my hips are actually off the floor? So all the weight is on that lacrosse ball. So you compress the tissues, and then you're going to rotate towards that right side. So compress and rotate. Good. So you're going to work that entire muscle belly to keep working it up the spine. So you find the tender spot, put all your weight on it, let it compress, then you're going to rotate towards that side. This position here while we're here is also really good to work that sacroiliac joint. So your SI joint right through here, if you have some pain, take the lacrosse ball, put all your weight on it, and actually you can do some cross friction. You kind of just roll around that joint. That's going to break adhesions, those adhesions around that sacroiliac joint. So hopefully you guys found that helpful. So visit us at westside-medical.com.